Thank you so much, Brett. If you've ever had shoulder problems, you know it can be a really nagging injury, but you shouldn't be resigned to battling frequent shoulder pain. Dr. Michael Gilbert, owner of Gilbert Physical Therapy, is here to explain the prevention and treatment of shoulder injuries. Welcome back to the show.
Well, thank you.
Always good to have you. We always learn so much. So we're going to talk about the shoulder pain, some of the common causes. Why does that ache so much?
Well, some of the biggest reasons that we'll treat shoulder pain in our clinic will be for something that's primarily known as an impingement syndrome. This is where you're going to have two of the bones coming together and compressing on a muscle.
Yeah, that would hurt.
There will be rotator cuff tears. There is something called an adhesive capsulitis, which some people refer to as a frozen shoulder.
Okay.
There will also be just a generalized instability from someone who may dislocate a shoulder. And then there's a tissue within the shoulder called a labrum, and that can commonly tear as well.
Okay, so there are lots of reasons. You mentioned rotator cuff. How does that tear happen?
So a rotator cuff tear happens when there's an impingement between two of the bones. And generally a tear will start as an impingement syndrome first, and then it will lead to the tear. So there's a specific muscle that comes right through this space.
Okay.
It's known as the subacromial space. When someone lifts their arm up, that space closes down, and over time that can rub onto the tendon, and it so slowly frays apart and eventually will tear.
Oh, that does sound very painful. So, I mean, is this something that naturally happens over time, or is there something you can do to prevent it?
Well, prevention comes from making sure that the shoulder is strong. The shoulder is primarily held to the body by muscles. And so when the muscles are weak, it will cause the shoulder to work inappropriately. And that's what creates this bone coming up into the one above.
Okay.
Generally, this space is supposed to remain open, and the rotator cuff is a group of 4 muscles. Most of us think it's an actual structure, but it's 4 muscles.
Okay.
When they are weak, it doesn't allow that space to maintain, and that's when they will start to become pinched and torn on. So it's important to keep them strong.
But even once that happens, physical therapy, though, still can help. It's not a lost cause here.
Exactly, it can still help. You can actually have one muscle of the 4 torn, and if you strengthen the rest of them, some folks will be able to prevent a surgery, and the shoulder will function just fine.
That's very good. Important to know. When it comes to physical therapy, a lot of folks really still think, and we keep telling them this isn't the case, but that you have to get a referral. But folks can choose anywhere, right?
Correct. If your doctor recommends you have physical therapy, you can go wherever you would like to go. And also it's important to note that if you have not seen your doctor and you're having shoulder pain, you do not necessarily have to see them first. They can come directly to us and be seen.
Very good. No referral needed. And you, I love this, always bring a special offer for Good Day PA viewers. What do you have for us today?
So exclusive for Good Day PA viewers today, we're going to offer 15 free screens. We're talking about the shoulder. It'd be a great way for anybody with shoulder pain to get their shoulder looked at.
Sure.
If you call in to our office, mention that you saw us on the show, we will get you set up for a free screen, and that is for the first 15 callers.
Okay, so get on the phone there, everybody. Tell us where you're located.
So we are on the Carlisle Pike in Mechanicsburg.
Very good. Good to have you always. Thank you,
Thank
Dr.
you.
Gilbert.